Okay, I've seen a couple comments like this one on my TikTok video that I made, plus on my Instagram. So I wanted to kind of talk about it a little bit. So sometimes patients have really, really bad like moisture associated skin breakdown from being incontinent or having frequent loose stools and getting cleaned up a lot. So when patients have diarrhea, especially in the ICU, we'll put an rectal tube in just to protect their peri area. However, the goal is never to like really have diarrhea. Even if they have a bunch of skin breakdown, we'd put the rectal tube in to help the diarrhea, stay in a contained spot and not get on their skin as much. But we would not want to continue having the diarrhea because you're losing a lot of fluid, electrolytes, and whatnot. It's not healthy to sustain diarrhea. So we would leave the rectal tube in ideally until the diarrhea resolves and then take it out. And even if the skin is still kind of irritated, if you're not having as many loose stools, then you shouldn't need to, the skin issues should get better over time. Especially if you're doing good peri-care, making sure you're protecting the skin with like a barrier cream or ointment. And yeah, it's not really an indication to continue having diarrhea, just to continue having a rectal tube, just because your skin peri area is irritated. It would be better to resolve the diarrhea and have them have like formed stools once or twice a day versus having continuous diarrhea just to keep a rectal tube. So at least at my hospital, that's the ideal thing that we do. Now, sometimes patients have really bad sacral wounds and they're waiting for like a diverting ostomy. And in this case, yeah, we'd want to keep that rectal tube in and whatnot and prevent the patient from getting stool in their wound. However, that would be a very temporary measure until they got their surgery. And again, diarrhea, we would not want to sustain having diarrhea even for that.